Yeah.
Okay, good. Thanks everybody for being here today. Just want a bit of change on the seating plan, if that's okay. So Jess, I just want you to go over that side, and Pooja, come over closer to me so you can hear me better.
Yeah.
And unfortunately, we've got a mask on, and hopefully, you can hear me better. And Pooja, let me know if you can't hear me properly. Okay,
Yeah.
I'll just try to increase my tone up a bit.
Okay.
All right, let's start. So today we're going to talk about heart failure. Now, we've seen a lot of cases with heart failure. So what is heart failure?
So, yeah, you first. Due to decreased contractility of your cardiac muscles, your heart's unable to pump blood efficiently as it used to be before. So that is what
That's it.
simply.
Yeah. So it is a combination of a clinical syndrome that basically means that you've got a lot of systems involved with heart failure. It's not only heart. So it's the signs and symptoms with fluid overload, inadequate tissue perfusion. So it is progressive, long-time condition. So what does that mean? Lifelong condition. What do you think that is?
So I think it occurs very long time before. It's a condition that it has been there before, and it just like it takes time. It takes so long until the time comes, the heart doesn't pump properly.
Yeah.
It's not reversible.
Yeah,
That's
yeah,
right.
that is
Exactly. Yeah, it's a chronic disease. Not like pneumonia. You got treated, you finish. You are healthy now. But not like this. So heart failure is a chronic condition. It's the person has to live with the heart failure condition throughout their life. So basically, that's what it is. So how can you manage it? It's with the lifestyle changes. I don't know why I wrote and, but anyway, this is lifestyle management that you need to do. Now, pathophysiology. I've got lots of information there, but I just want to simplify it very, very simple. So what happens in heart failure means that your ejection is you are not bringing a lot of output because the contractility is quite poor. So what that happens, your body recognizes that, okay, you're not pumping up enough blood. So what that does is lots of neurohormonal compensatory mechanism goes on. That means your body's starting to produce a lot of epinephrine, norepinephrine. What is that? That is the fight and flight response. So that means your heart's pumping up a lot because that's like a fight and flight response. That's one thing I want you to remember. Another thing is what happens is your body's not producing enough cardiac output, and your renal, your kidney is not getting enough supply. Then what that does is produce a lot of angiotensin 1, which converts to angiotensin 2. What that does constricts the peripheries and trying to increase the blood volume. At the same time, it causes sodium and fluid restriction. So that's number 2. So, and then number 3, what happens is your muscle in the heart, because it's not producing enough blood supply, then your muscle is starting to contract a lot as well. So all these 3 things are the compensatory mechanism. And then over the time, the heart's going to say, okay, that's it. I can't do too long. You've been asking me to work too hard, and I can't do much. Then what happens is the thickness is going to go increase, but whether it's like a floppy one. The thickness will go increase, but the contractility is even getting poor. So the longer you are producing this epinephrine and norepinephrine, and the longer you are having this, releasing angiotensin 1 to angiotensin 2, then the prognosis will be poor. So that's the compensatory mechanism of heart failure. So it's actually trying to help, but it is not. Longer term, it is not. It doesn't make sense?
Yeah, no, it does make sense.
Yeah. It is very complicated. Heart failure is a really, really complicated thing because it only doesn't take one organ, it takes like whole different hormonal to kidneys, like all over the place. Okay, just checking.
Yeah, me too.
Okay, now have you heard about New York Heart Foundation, New York Heart Association? Yes? NYHA. So this is the classification of heart failure to establish like how advanced the heart failure is. So that means we've got like class 1, class 2, class 3, and class 4. And it's very easy to remember because class 1, you've got a heart failure, but there's no limitation. It means that if you don't have short of breath or you don't have leg swelling or things like that. With class 2, you've got slight limitation like if you walk a little bit far, then you get short of breath and get leg swelling, things like that. With class 3, you're not doing anything, but you're still getting short of breath. But that's marked, so you exactly know that it's like a bit advanced stage already. With class 4, it's severe, you'll get symptoms even at rest. So this is when we think about palliating the patients. So I'm doing the recording as well. Okay, now you'll see with class 1, people probably don't know that they've got heart failure. With class 2, they said, okay, hopefully, if I do a bit of exercise, like a bit of walking 2 meters, something like starting to get short of breath, things like that. With 3, they're already like freaking flyer, ready to CCU, having to do a lot of acute decompensation of heart failure, things like that. With class 4, like extreme, like really end stage of heart failure. So those are the symptoms described by New York Heart Association. So before I go to the causes, I just want to ask you, what do you think the causes of heart failure?
High cholesterol, hypertension, fluid retention, hypertension, previous
MI
heart
maybe?
cardiac
attacks?
infarction.
MI is the main reason, like especially the LAV territory, when they have the MIs there, the anterior part of the heart is mostly damaged. So main is coronary artery disease. If they had recent MIs, not recent, if they had MIs in the past, so that's another worst reason. And another one is hypertension, AF.
Arrhythmias.
That's right. So AF, hypertension, because they are working so hard, they've got lots of the resistance, and that the heart has to work hard against that peripheral resistance, and they develop heart failure as well. Cardiomyopathy is pulmonary hypertension, so that's again the resistive big issue because the pulmonary if the hypertension, the muscles have to work so hard to pass the blood across that. Valvular heart disease similar, like arrhythmia, which is like more AF patient, I mean long-term AF patient can have heart failure. And drugs, we see a few cases with the drugs after having, after using lots of IBTU, kind of think the hearts just can't cope with the effect of that, and infections as well. So diagnostic tools, what other things we can do?
Echo?
That's a definitive diagnosis to find out
What they will do? PP,
Angiogram today.
what we do? PP,
ProBNP.
PBNP blood
yeah.
test.
Yeah, ECG, even chest X-ray. Simple like chest X-ray, you can see the
heart.
Yeah, that's right. So MRI, CT scan, catheterization, angiogram. Alright, so with the left, there's two different aspects left. This is a normal lungs, and that's a pulmonary edema. That means that there's a lot of blood flow going on. Left-sided heart failure. What do you think that is?
So that's
Pulmonary symptoms.
Left-sided.
Left side as well.
So left-sided heart failure. So when you say, what do you say? If you got like lots of APL, that basically left-sided heart failure because the left ventricle is affected more than right ventricle.
Right.
When you have left-sided of the heart ventricle is affected, there's a backflow which is going back to the lungs, and that's when you get the APL. With the right-sided heart failure, which is the right ventricle is affected, and then you go backflow towards the jugular and then towards the arthritis and down the legs, like swelling of the legs as well. But longer term, they have like a biventricular failure because it affects both. Yeah. So that's what right-sided heart failure and includes jugular, distended legs, anorexia. Do you know why anorexia and weight loss?
and with her appetite.
Because lots of fluids towards the abdomen,
Ah,
and they
abdomen side, they don't want
they
to-
always feel full. The
full.
side is that can affect the mechanism. Now, pharmacotherapy is I've written a few things here. ACE example.
Ramipro, Parenteral,
Yeah,
Parenteral.
exactly. Yeah, and angiotensin II receptor blockers. So as per the Heart Foundation, the guideline says that the first line medication for heart failure is ACE. If they can't tolerate ACE, like Ramipril, they can give you cough, make you like uncomfortable, and then you can go into angiotensin II ARBs, which is what? Irbesartan.
Irbesartan,
That's
yeah.
right. So that's that. So second line drug comes to beta blockers, which is
Metoprolol,
so again
Lisinopril.
saying that when you actually have acute episodes of heart failure, then you don't give beta blockers because that can actually go into cardiac shocks and things like that. So to start with ACE,
ACE.
I know with the heart failure, acute episodes of heart failure, with blood pushes as well, that they try to push because what ACE does, it's you know how we said that there's an angiotensin 1 converts to angiotensin 2.
Essential.
So we're actually trying to block that
enzyme.
cycle. So, and this one has got mild effect of dialysis as well. So it prevents from food retention too. And it showed lots of mortality benefit as well as morbidity.
The ACE inhibitor.
Come in. So diuretics, it doesn't have any mortality benefit. It's only for the symptom management. Calcium channel visitalis if they've got AF, you know, any other on if there's got lots of arrhythmias, things like that. Now, what's the treat? What can we do for the heart failure? The first thing, treat the cause. Like if it's MI, if we can stent the patient, stent the patient. If it's a valve, send the patient for
Valve
valve
surgery.
surgery if they can. AF, try to fix the AF. We try to treat the cause, but if we can't, then we're just going to have to manage to live with the heart failure. So this one is very important, is nutritional therapy. So why do we restrict sodium?
Fluid attraction,
That's
so you
right.
accumulate more fluid.
Exactly, yeah. Because the person is already retaining the fluid, retaining the sodium, and we want to restrict the fluid restriction, the sodium restriction up to 2 to 3 grams daily. And that's a very, very hard thing to do for the patient. Come in. Because everything's got salt in it. And what you need to teach the patient is try to read the labels to see how much sugar in it, how much salt in it, sodium in it. Yeah. And that's a very important thing that we need to teach patients. And patient compliance. And again with the sodium restriction, patients do not comply at all because food doesn't taste nice without salt. So, all right. So additional therapy, what can you do for the heart failure patients?
Yeah, oxygen is
Oxygen.
hard to breathe.
Yeah. Now, do you know what cardiac synchronization therapy means?
The
Is it like a
pace?
cardiology sort of thing?
No.
After the pace.
It's the CRT,
That's right.
CRT
CRT.
devices.
It's a CRTD device. So AICD and CRTD
Okay.
is similar but a bit different. The AICD doesn't synchronize because heart failure patient they've got floppy heart. One contract at one time, another contracts at different time. There's no synchronization. With CRTD, it's a biventricular pacing as well. They've got the ventricle. There's got a lead in the 3 leads. Goes to right atrium, right ventricle, and then left atrium. So what that does is helps to pump the ventricles together. That means that your cardiac output is much better than
To synchronize, yeah, it helps, yeah.
Yeah. So that's like a much effective
Than the
treatment for
AICD.
low EF patients. And also AICD, and that could be either primary prevention or secondary prevention. If the EF is low, they've got different guidelines. They try out for 3 months of medications to see whether that improves the EF. If it doesn't, then it qualifies for an AICD. Autofiltration, that's just if they got like really bad kidney functions. Eventually down the track, the kidney is going to fail as well. So cardiac transplant, not many of our patients are eligible for that, but there's another option available. Now I want to focus on the nursing assessment. So what are the things we can talk to the patients with heart failure patients? The main thing is
Adhering to their fluid restrictions.
exactly.
Because low sodium diet,
Yeah.
Mhm.
medication,
Medication,
Yeah.
lifestyle
Yeah.
changes.
Exactly. Yeah. So promoting activity as well, managing fluid burden, controlling anxiety is another thing that people forget because heart failure patients are quite depressed.
depressed.
Because they're not being able to do what they were doing. They've got this tag now. You've got heart failure, you've got chronic disease, and that gives the patient anxiety. So for some of the people, you can actually advocate like, okay, I think this patient needs some sertraline or some kind of antidepressants prescribed, which I've done that previously. That helped. They just won't be able to sleep, and nocturnal dyspnea is another thing with heart failure. They're sleeping and suddenly I can't breathe. That's normal kind of feeling for them. And minimizing the powerlessness, that basically means they're giving the authority to the patient to make their decisions for their health. So that's what I went through with. Chris, fun. What is class 4 heart failure symptoms?
Symptoms at rest
With
and
rest.
exercise and no relief.
Yeah. So that's the end stage.
End
Yeah.
stage,
And
yeah.
that's when we are looking into the palliative care.
Mhm.
And that's another thing. Here, people don't look into the palliative care as much as it should. So sometimes you actually have to think, do you think we should, think about palliation or advanced care plan or something like that at this stage of the time. Yeah. 3 causes of heart failure again.
MI,
MI, arrhythmia,
hypertension,
pulmonary hypertension.
Yeah. So 3 self-management strategies that you can talk to the patient.
reducing their sodium, fluid management,
Anxiety.
Exactly. Yeah. Yeah. So for anxiety thing, it's just even helpful if they can just walk around the outside atmosphere a little bit longer.
Medications.
Exactly. That's all. Okay. Do you wanna give any feedback?
It was good, like very self-explanatory, very easy to understand.
and relevant.
Relevant.
Very
Yeah.
well presented. And we get a lot of heart failure patients. It's good to refresh on the memory. So it was very informative.
Right. Thank you guys.
Thank you.
Imagine